the cavities and fill them. When you have cavities or something wrong with the filling, that it's not doing its job of blocking out bacteria from entering in this area into the interior part of the tooth, you have to work on it again. And on this particular filling that you saw, that's what we have to do. So when you clean out the old filling, whatever's left of the tooth, you may not have enough to fill. You may have to do a crown. In this case, we would, because look how big this filling is. If I have to go in and clean out this filling, for whatever reason, it's going to get a crown. Because why? I don't want the patient to break the tooth and then lose a tooth. That would be the worst case scenario. Okay? Now, going back to how deep this filling is. This is about 2.5 millimeter deep. Because from here to here is 4 millimeters. You can always, for adult teeth, you can always plan on about 4 millimeters between the outer surface of the tooth and the nerve. On an average. Okay? Now, because our patient is much older, I'm going to change the contrast here to increase the contrast so that you can see where her nerve is at. This is where her nerve is at, right here. Okay? Now you think, oh gosh, doctor, you have a whole 2 millimeters there. The nerve doesn't end just right here or right here. This is what you can see on the x-ray. But in dentistry, we always tell you to go 1 millimeter before that. So it ends about right here. So if my nerve ends right here, and my filling ends right here, if I have any bacterial decay down here, it's already into the nerve. The bacteria is already at the nerve. Whether the patient feels pain or not is irrelevant. They're already there. Okay? Any questions about looking at an x-ray, seeing how big look at this filling. What do you think the treatment for this? A filling or a crown?
Crown.
How about here?
Yeah, almost like the filling.
A filling, a big filling,
yeah.
Or a crown. Okay? So
depending on the decay, right?
Depending on how much of the tooth structure is missing. Right? Depending on the decay is whether it needs a root canal. Right? Okay. Alright. So when you're looking at an x-ray for the back teeth, it goes from 1, 2, 3, 4, 5. On the other side of the mouth is 12, 13, 14, 15, so forth. 16. Okay? So here you have a big filling and a medium-sized filling. This could possibly be just a filling, not a crown. Okay? Now, on this particular x-ray, Stephanie, what can I use this x-ray for? Can I use it for a root canal in 12, 13, 14, 15? Why is that?
Because you can't see the apex.
That's correct. A diagnostic quality x-ray of an entire tooth needs to encompass the apex of the tooth, preferably 5 millimeters beyond. This has got maybe 1.5. But I can see the periodontal ligament space, which tells me it's healthy. So if this tooth came in and it was in pain, and I tested it, I tapped on it and it hurts, I have this x-ray, and I have the patient saying, hey, it hurt so bad last night I couldn't sleep. I took ibuprofen, I woke up at 3 again, I had to take another ibuprofen. I jot that down, combined with today's percussion, plus when I tap on the tooth lightly, he jumps out of my chair, that's 10 out of 10 pain, or he was about to punch me, you know. Or he says, I put my tongue on it and it hurts. Then I have all the evidence I need to prove that he needs a root canal. The onus is on us to prove why we did what we did.
Right.
Okay? And so everything in this office that we put together is redundancy, redundancy, redundancy to help each other. You got trained starting February. You're getting trained started this past month. So, redundancy. One day, you're going to be out because your kids are in the hospital. You need to step in until she gets back. If she doesn't train you properly, when she comes back, she has about 3 months worth of work that she has to hassle through. That's not my fault. You understand?
Yes.
Same thing with the two of y'all. You want to go off on a trip to Europe, you're going to have to deal with it until she gets back. Vice versa. No different. Same thing with you and Apple. No different. Okay? All right. Is there any issue here based on the information that I gave you yet today? Do we see any abscesses? No.
I